By the time a doctor finally says the word prediabetes to you, your body has usually been quietly struggling with your blood sugar for close to 10 years. And right now, more than 1 in 3 American adults is walking around with it, most of them feeling completely fine and having no idea. I am Dr. Hale. I have spent 15 years in internal medicine, and in my practice I have watched this exact thing play out hundreds of times. A patient in their 40s or 50s, busy, active, no big complaints. Their fasting number creeps up 1 point a year. Nobody says anything because each single reading still looks close enough to normal, and then one ordinary morning the label lands, and they feel like it came out of nowhere. It did not come out of nowhere. It had been building in plain sight. Here is the part that should actually give you hope. The Centers for Disease Control reports that prediabetes is not a one-way street. It is reversible. Losing a modest amount of weight and moving your body more can cut your risk of ever developing type 2 diabetes roughly in half. So this is not a video about fear. This is a video about the window that is open for you today, whether you are 45 or 75. In the next few minutes, I am going to give you 5 simple, evidence-backed levers you can pull to steady your blood sugar as you age. A short walk you can do in your kitchen, the order you eat your food in, what to put on the plate next to the bread, a kind of exercise almost nobody over 40 is doing enough of, and a 5th lever that has nothing to do with food or the gym at all, and it is the one most people skip completely. Stay to the end for that one. It might be the most powerful of them all. But before any of that, you need to understand what is actually going wrong inside you. Because once you see it, every one of these levers stops feeling like a rule and starts feeling obvious. Let me explain blood sugar the simple way. Every time you eat, especially anything with bread, rice, pasta, potatoes, fruit, or sugar, your body breaks it down into glucose, and that glucose goes into your blood. Your blood is not meant to hold much of it at once. So your pancreas sends out a hormone called insulin, and insulin has one main job. It knocks on the door of your cells and tells them to open up and let the sugar in, out of the blood and into the tissue where it gets used or stored. Picture insulin as a key. Picture the surface of your cells as covered in locks. When you are young and healthy, the key turns easily, the door swings open, and the sugar moves out of your blood within an hour or two. Smooth. Quiet. No drama. Now here is what changes as the years add up, and often as a little weight settles around the middle. The locks get stiff. The same key that used to open the door in one turn now has to jiggle and force it. Your pancreas notices the sugar is not clearing fast enough, so it does the only thing it knows how to do. It makes more keys. More insulin. For a while, brute force works, and your blood sugar still looks normal on a test, but your insulin is running high all day to keep it there, and that is the hidden decade nobody sees. Eventually, the pancreas cannot keep up. The sugar starts staying in the blood too long, and now the number on the lab report finally moves. That stiff lock has a name. It is called insulin resistance, and it is the real engine underneath prediabetes and type 2 diabetes both. Now, why does the lock get stiff in the first place? A big part of the answer is sitting around your middle. The fat that collects deep in your belly, the kind that pushes your waistband out, is not a quiet cushion. It is an active, restless tissue that leaks a steady stream of inflammatory signals into your blood. Think of it as a small factory running day and night, and its product is exactly the stuff that gums up the locks on your cells. This is why 2 people can weigh nearly the same, and the one carrying it in the belly is in far more trouble than the one carrying it in the hips and legs. It is also why losing even a little of that belly fat pays off out of all proportion to the number on the scale. You are not just getting lighter, you are shutting down the factory. Hold that in your mind, because it is the reason the levers I am about to give you work as well as they do. So the whole game is simple to state. We want to make your cells listen to insulin again. We want to oil that lock. We want to quiet that factory around the middle. And the single biggest place all of that happens is a tissue you might not expect. Your muscles. Your muscles are the largest sugar sponge in your entire body. After a meal, the great majority of that glucose is meant to be soaked up by muscle. When your muscle is active and healthy, it drinks sugar out of your blood like a dry sponge dropped in water. When your muscle is idle and shrinking, that sponge sits there wrung out and hard, and the sugar has nowhere to go but to keep circulating. Hold on to that picture of the sponge, because 4 of our 5 levers are really just different ways of squeezing it and helping it soak. Lever 1 is the easiest thing I will ask of you all day. Walk after you eat. Not a workout. Not a mile. Just a few minutes of easy movement after your meals. Here is why it works, and it is beautiful. When a muscle contracts, it can pull sugar out of your blood without even needing insulin to unlock the door. The contraction itself opens a side entrance, so a gentle walk after eating is like reaching over and squeezing that sponge exactly when it is soaking up the sugar from your meal. A 2022 analysis published in the journal Sports Medicine pooled several studies and found that light walking after a meal meaningfully lowered the blood sugar spike compared with sitting still, and you did not need much. Even 2 to 5 minutes of strolling made a real difference, and short walking breaks worked nearly as well as one longer walk. Think about what that means for your day. After dinner, instead of dropping onto the couch while your blood sugar climbs to its peak and sits there, you take a slow loop around the block, or you just tidy the kitchen on your feet for 5 minutes. That is it. You are not training for anything. You are squeezing the sponge at the one moment it matters most. Do it after your biggest meal of the day, and you have already done something most people never do. Lever 2 costs you nothing and changes only the order you already eat. Eat your fiber and vegetables first, and save the bread and the starch for last. Your food does not have to hit your bloodstream in the order it sits on the plate. When vegetables, fiber, and protein go in first, they form a kind of soft mesh in your stomach and slow down how fast everything empties into your gut. So the sugar from the rice or the roll trickles in gently instead of flooding in all at once. Picture 2 ways of emptying a bucket of water into a drain. Dump it, and it overflows. Pour it slowly, and the drain handles every drop, same water. Different flood. This is not folk wisdom. Researchers at Weill Cornell Medicine tested it directly. When people ate their vegetables and protein before their carbohydrate, their post-meal blood sugar was dramatically lower than when they ate the same exact meal in the reverse order. Same food. Same calories. Only the order changed. And the American Diabetes Association, in its own journal Diabetes Care, has published work showing that saving carbohydrates for last consistently flattens the spike after a meal. So start with the salad and the chicken. End with the potato. Your body will thank you, and it costs you not one thing. Lever 3 lives right next to lever 2. Never eat your carbohydrates naked. Always dress them with protein and fat. A slice of plain white toast by itself hits your blood like that overflowing bucket, but put an egg on it, or some avocado, or a bit of nut butter, and you have slowed the whole thing down. Protein and fat take longer to digest, and they drag the sugar along at their slower pace. Plain crackers spike you. Crackers with cheese do not nearly as much. An apple alone is fine, but an apple with a handful of almonds is far gentler. The rule is short enough to keep forever. If it is a carbohydrate, give it a partner. Now, if this is already helping you see your own kitchen differently, do me a small favor and subscribe to Dr. Hale, and tell me in the comments how old you are. I read them, and the ages of the people watching genuinely shape what I make next. Are you in your 40s getting ahead of this, or in your 60s taking control of it? Tell me. Then come right back, because lever 4 is the one that builds you a bigger sponge, and lever 5 is the one almost everybody misses. Lever 4 is strength. I want you lifting something heavy, in a safe and sensible way, 2 or 3 times a week. Remember that your muscle is the sugar sponge. Well, the more muscle you have, the bigger the sponge. Cardio is wonderful for your heart, but if you want more room to store and burn sugar, you have to build and keep muscle, and that means resistance. Bands, dumbbells, machines, or just standing up out of a chair over and over. Here is the quiet trouble nobody warns you about. Starting in your 40s, if you do nothing, you lose muscle every single decade. Your sponge is silently shrinking right when you need it most. Research on older adults is clear that resistance training improves how the body handles glucose. It works 2 ways at once. In the moment, the contraction pulls sugar in through that insulin-free side door we talked about. And over time, the new muscle you build means more places to park sugar and a lock that turns more easily for days afterward. You do not need to look like a bodybuilder. You need to keep the muscle you have and add a little back. A person in their 70s can build strength. This is not a young person's project. This is a longevity project, and it is open to you at any age. And here is the part I love about this lever. Muscle keeps working for you long after you put the weights down. A brisk walk lowers your sugar for that hour. Muscle you have built lowers it around the clock, hungry for glucose even while you sleep. That is why I would rather you do 10 honest minutes of resistance twice a week than nothing at all. 2 chairs, your own body weight, a couple of soup cans if that is what you have. Start absurdly small. Just start. Now lever 5. The one I promised you, the one that has nothing to do with food or the gym, and the one that most people skip entirely. Sleep and stress. Here is the mechanism, and it will change how you see a bad night. When you are short on sleep or living under steady stress, your body pumps out a hormone called cortisol. Cortisol is your ancient alarm system, and its whole purpose is to flood your blood with sugar so you have quick fuel to run from danger. That was brilliant when the danger was a lion. It is a disaster when the danger is a deadline, or a screen at midnight, or a night of broken sleep, because there is no lion to run from and no sprint to burn that sugar off. It just sits in your blood. Studies published in the American Diabetes Association's own journal have shown that even a single week of short sleep in healthy people measurably reduces insulin sensitivity. In plain words, 1 bad week of sleep can stiffen those locks all on its own, no change in diet required. So you can walk after every meal, eat in perfect order, lift twice a week, and still fight an uphill battle if you are sleeping 5 hours a night and running on stress. That is why I saved this one for last. People will happily change their whole plate and never once consider that their blood sugar problem is partly a sleep problem. Protect your sleep like it is medicine, because for your blood sugar, it is. Let me make this real with one person. I am going to call him Gary, and Gary is a composite, a blend of many patients I have seen, not one specific man. Gary came to me at 51, fasting sugar creeping up, a little extra weight sitting right around his belt, tired in the afternoons, and frankly a little scared, because his father had lost a foot to diabetes. He did not want pills yet. He wanted to know if there was anything real he could do first. We did not overhaul his life. We picked the levers. A 10-minute walk after dinner every night, no exceptions, salad and protein before the pasta, almonds with his afternoon fruit instead of a cookie alone, 2 short strength sessions a week with a set of bands in his garage, and a firm rule about being in bed by 11. That last one, he told me later, was the hardest and the one that surprised him most. Over several months, Gary's numbers walked back down out of the danger zone, not with a miracle. with 5 ordinary levers pulled steadily. His story is the reason I made this video. Now I have to be completely honest with you, because honesty is the whole point of this channel, and this next part is the most important thing I will say. Everything I have described supports your blood sugar. It does not replace medication for anyone who has been prescribed it. If you are already on a diabetes medicine, especially insulin, or a class of drugs that can drop your sugar too low, you cannot simply start walking after every meal and cutting carbs without telling your doctor. Here is why that matters so much. These habits genuinely lower your blood sugar. If your medication dose was set for your old habits, and you suddenly add powerful new ones on top, your sugar can drop too far. That is called hypoglycemia, and it is dangerous. So the levers do not replace your doctor. They are a conversation to bring to your doctor. Say, "I want to do these things. Please help me adjust my medicine safely as I do." That is exactly how it is supposed to work. And there are moments that are not about slow prevention at all. If you feel shaky, sweaty, confused, your heart is pounding, or you feel like you might pass out, that can be blood sugar dropping too low, and that needs sugar and attention right now, not later. On the other side, extreme thirst, urinating constantly, blurry vision, and deep unexplained fatigue can mean sugar running dangerously high. Those are not lifestyle moments. Those are call your doctor today moments, and some are call for help right now moments. Please treat them that way. Everything else here is education, not a prescription. I do not know your body, your medicines, or your history. Bring what you learn to the person who does. So let me hand you the plan, clean and simple, to start this week. 1. After your largest meal, walk for 5 to 10 easy minutes. Squeeze the sponge. 2. At every meal, eat your vegetables and protein first, and save the bread, rice, or potato for last. 3. Never eat a carbohydrate naked. Always give it a partner of protein or fat. 4. 2 or 3 times a week, do something that makes a muscle work against resistance. Keep the sponge you have and build a little more. 5. Guard your sleep and lower your stress like they are part of the treatment, because they are. Aim for a real 7 to 8 hours. And underneath all 5, know that even modest weight loss around the middle, the kind that follows naturally when you do these things, is powerful on its own. The National Institute of Diabetes and Digestive and Kidney Diseases ran a major study called the Diabetes Prevention Program. In people with prediabetes, losing about 7% of their body weight and walking around 150 minutes a week cut their odds of progressing to diabetes by 58%. That is more than half. And in that same study, that lifestyle approach beat the leading medication head-to-head. You are not powerless here. You may be more powerful than you were ever told. Here is where I will leave you today. We spent this whole video on sugar, but sugar is only half of a story. Because right alongside high blood sugar, quietly, sits a different number that most people over 40 never think to check, and it damages your arteries in silence for years before it ever gives you a symptom. It is a number you can move with food, and yet almost nobody knows the 2 simple morning habits that move it most. In my next video, I am going to walk you through it, sign by sign, and show you exactly what to do. Subscribe so it finds you when it goes up. Whether you are 45 or 75, you are never too early and never too late to steady this. And the version of you 10 years from now is built by the small things you choose this week. I am Dr. Hale. Take care of yourself.